order. I express my gratitude to our witnesses for joining us today. We're going to consider 24 pieces of legislation sponsored by me, the ranking member, and senators from both sides of the aisle. That includes two bills that I introduced. The Fisher House Availability Act would allow families of service members to stay at VA Fisher houses if the service member is being treated at a nearby VA Fisher house. I'm sure I didn't say that right, is being treated near a VA Fisher house while still prioritizing space for family members of VA patients. And the SERVE Act, which would improve relationships between the VA medical centers and military treatment facilities to improve access to care for service members and veterans and increase training opportunities for the VA and DoD healthcare providers. I appreciate the support of this legislation that it's received from my colleagues across Capitol Hill as well as from Veteran Service Organization community, and I'm pleased to see its inclusion in FY 26 NDAA. I look forward to it being enacted into law and seeing how it will benefit the veteran and military communities moving forward. And turning back to today's hearing, as we move away a moment from NDAA, the bills on the agenda today represent a number of bipartisan priorities that would build on the successes Congress has achieved in expanding access to care and benefits for veterans, survivors, and their families, a notion that all of us on this committee share. I'm grateful to the sponsors of all of these bills for their work on these pieces of legislation. I'm grateful to the VA for providing technical assistance on the legislation and to our Veteran Service Organization partners for working well with us to improve and advance the bills. With that, I yield to the ranking member, Senator Blumenthal.
Thanks, Mr. Chairman. I appreciate the opportunity to hear testimony on some very important bipartisan legislation today, but before we begin, I think we have to recognize the importance of votes that we will take tomorrow. One of them to extend the health care tax credits under the Affordable Care Act that will affect literally 267,000 veterans who rely on the ACA enhanced premium tax credits to afford health insurance. And whether you support the ACA, whether you have other views on what might be a perfect system in the long run, if we had tons of time, the simple fact is we face a deadline of the end of the year when these tax credits will expire, and 267,000 veterans will no longer be able to afford ACA coverage if these credits are not extended. These are primarily veterans who are not eligible for Medicaid, TRICARE, or Medicare, and often not eligible to get their care through the VA, leaving them with the ACA marketplace plans as the only option for health care coverage. The ACA isn't perfect. We need to lower the costs of health care generally. We need to work on reforms. And we need to eliminate any fraud that exists in these programs. But the fact of the matter is the consequences of failing to extend these tax credits will be devastating for veterans and their families. Veterans will be forced to navigate a perfect storm: an understaffed VA healthcare system, increased wait times for VA healthcare, Medicaid cuts, and the loss of affordable health insurance. They deserve better, so do millions of Americans who will be impacted by the potential failure to extend these tax credits. I hope that we approve them to the benefit of those veterans and countless other Americans affected. On the legislation today, I want to particularly thank Mr. Stickman for his work alongside the Yale Veterans Legal Services Clinic to improve how federal appellate courts process VA appeals. I've worked with the Yale Veterans Legal Services Clinic over the years, and I know how important their work is generally. The Veterans Appeals Efficiency Act, which I co-led with Senator Banks, is one of the many bills that we're here to discuss, and I will be supporting many, if not all of them. For example, the Molly Loomis Act, which would build on the promise of the PAC Act by exploring health conditions prevalent among descendants of veterans who were exposed to toxic substances, during their service, and we have to confront as well the painful legacy of discrimination. The Commission on Equity and Reconciliation in the Uniformed Service Act would investigate the harm done to LGBTQ service members and veterans, many of whom received punitive discharges and were forced to hide their identities and ultimately denied benefits. These measures are not partisan. This committee generally is not partisan, and I welcome the support of my Republican colleagues for many of these important measures that we hopefully will advance after today's hearing. Thank you.
Thank you, Ranking Member. Introduce our first panel. Testifying today from the Department of Veterans Affairs is Margarita Devlin, the Acting Principal Deputy Undersecretary for Benefits, and she is accompanied by Thomas O'Toole, the Acting Assistant Undersecretary for Health for Clinical Services, Veterans Health Administration. Thank you both for being here, and Ms. Devlin, I now recognize you for your opening statement.
Good afternoon, Chairman Moran and Ranking Member Blumenthal. Thank you for inviting us to speak on VA's views on the legislation before us today. I am joined by Dr. Thomas O'Toole, Deputy Assistant Undersecretary for Health from the Veterans Administration. Before we begin, I'd like to apologize for the delay in providing testimony to this committee. VA is working on process improvements internally as well as externally to ensure that this is prevented in the future.
Thank you for your regrets and acknowledgments, and we'll consider this probably most likely external challenges. Thank you very much.
Thank you. There are 24 bills on today's agenda, and while I won't be able to address each one of them in my opening remarks, I welcome the opportunity to answer your questions and provide any additional information the committee may need. VA's full views on the bills are submitted for the record in written testimony. VA has noted in our official views where important amendments would be needed to ensure feasibility of implementation. I will highlight several bills where VA either supports or supports the intent. VA supports the Fisher House Availability Act of 2025, introduced by Chairman Moran. This bill would expand access to temporary lodging in Fisher houses or other appropriate facilities for veterans and their families, not only when the veteran is receiving care, but also when a family member is receiving care. We appreciate the Chairman's leadership on this compassionate and practical proposal and support the bill subject to availability of appropriations. VA also supports the intent of the SERVE Act, also introduced by Chairman Moran, which seeks to improve access to care for veterans by leveraging the Department of War facilities and providers. While VA does not support the bill as currently drafted, we value our longstanding partnership with the Department of War and are confident that our cooperative relationship will continue to ensure veterans receive high-quality care. We welcome the opportunity to work with the committee to refine the bill's language and ensure clarity around provider roles, veteran choice, and coordination of care. Suicide prevention remains one of Secretary Collins' top priorities, and VA appreciates the intent behind the Saving Our Veterans Lives Act, introduced by Senator King. While we do not support the bill as drafted due to concerns about scope and cost, particularly the $5 million annual authorization, we are proud to report that VA has already launched a lockbox distribution program for enrolled veterans at medium to high risk of suicide who have access to firearms. This program includes provider ordering, tracking, and distribution, and is supported by VA's mandatory suicide prevention training, VA SAVE, which continues to be updated and expanded. VA appreciates the intent of the Molly R. Loomis Act, which would mandate research on health conditions in descendants of veterans exposed to toxic substances. While we support the goal of better understanding long-term impacts, we believe our existing programs, particularly those conducted in partnership with the National Academies of Sciences, already provides a robust framework for this research. VA supports the intent of the Purple Heart Education Act, introduced by Senator Murray, which would allow Purple Heart recipients to transfer post-9/11 GI Bill benefits to dependents. However, we recommend amending the bill to clarify the role of the Secretary of War in the transfer process, as current law requires coordination with the Department of War for approval and management of transferred benefits. VA appreciates the intent of the Obligations to Aberdeen's Trusted Heroes, or OATH Act of 2025, introduced by Ranking Member Blumenthal. While VA cites concerns regarding various sections as written and subject to appropriations, we welcome the opportunity to continue working with you and your staff to amend the language. VA also appreciates the goals of the Veterans Appeals Efficiency Act, introduced by Senator Banks and Ranking Member Blumenthal. We support efforts to improve transparency in the appeals process, but recommend amendments to ensure feasibility. For example, we suggest reporting legacy and AMA appeals remands separately, which would allow VA to sunset reporting on legacy remands once they are completed. We also recommend against the requirement to track and report when VBA adjudicators do not follow board remand instructions. Implementing this would require building a new review system for all post-remand decisions, demanding significant staff and IT resources. Even with system upgrades, VA anticipates several challenges in accurately tracking noncompliance. For instance, if the agency of original jurisdiction grants a claim without following the board's instructions, it is unclear whether that outcome would be considered noncompliance under the bill's language. Furthermore, under the Appeals Modernization Act, post-remand decisions are not automatically returned to the board. As a result, VA cannot confirm compliance with remand instructions unless the veteran chooses to appeal again. Mr. Chairman, that concludes my statement. Thank you again for the opportunity to discuss these important legislative proposals to improve benefits for veterans, service members, and their families. While I was unable to cover all the bills in my opening remarks, my colleague and I will be happy to answer any questions the committee may have.
Thank you, Ms. Devlin. And I thank you, the VA, for providing technical assistance in support of the SERV Act, which I am indicated earlier is now included in this year's NDAA. Ms. Devlin and Dr. O'Toole, besides the mandates that are included in the SERV Act to improve healthcare resource sharing between the VA and DOD, how else do you think the VA, DOD, and Congress could work together to improve access to care for service members and veterans in both of these federal health care programs? What do we do to make this a better, broader system?
I'll ask my colleague from VHA to answer that.
Thank you, Senator. And I think the question speaks to, an opportunity for us. Both systems have a long history of collaborating together. Both systems have a shared mission. And clearly, we want to also ultimately improve the transition from active duty to civilian life and hopefully VA care. I think there are several things that I think the SERV Act is a great step forward for us, and I appreciate the opportunity for us to continue to work with you and your staff on some of the concerns that we have. I think as we move forward, issues of the processes of credentialing and privileging and potentially working together with clinicians in military treatment facilities in a more seamless capacity is an opportunity. I look at models that we have, for instance, with the Lovell FHCC and Chicago Health System as a strong collaborative model for us to continue to develop. But I think this is an important and prioritized area for us.
Thank you for those suggestions and those comments. I want to speak just a moment about Fisher House and express my gratitude to those involved in Fisher House for the tremendous service they provide to veterans and to service members. The issue that's addressed in this legislation was in part a result from the VA unable to continuing a practice that they had previously due to lack of clarity in the law, and this bill is designed to make clarity. And I want to make sure that you agree, you support this legislation, but there's no question but what that clarity is now. Let me say it this way, that ambiguity is no longer going to necessitate any decline of the opportunity to serve service members' families.
Happy to speak to that, and that is exactly what we have heard from our facilities as they've also looked at the bill, that this provides that level of clarity. So thank you.
And then finally, let me turn to Senator Blumenthal. Senator Blumenthal.
Thanks, Mr. Chairman. I want to focus on the ACA tax credits. I've seen an estimate that a 1% increase in reliance by veterans on VA health care produces $2.6 billion in additional costs. So if 267,000 veterans are denied the ACA tax credits and they are not extended, presumably some major number will go to the VA healthcare system, significantly raising the costs to the VA. Have you done an analysis on the impact on the VA healthcare system of 267,000 veterans losing their ACA health insurance coverage?
Yeah, I am not aware of an analysis. I would definitely, take your word in terms of that transition, but I can't speak to any specific analyses or numbers and would have to take it for the record, sir.
So it would be fair to say that the additional cost of the VA healthcare system is going to be in the billions of dollars if we fail, that is, if the United States Senate fails to vote tomorrow to extend these healthcare subsidies.
Yeah, based on what you're describing in terms of the numbers in your analyses, yes, sir.
And you don't dispute them.
No reason to dispute them, but I also, again, want to be clear that we have not done the analyses. I have not done the analysis to be able to.
Well, you'd be in a position to dispute them if they sounded
Yeah,
wildly
if they sounded
wrong.
wildly, I would.
You know, there have been recent reports about the apparent demise of the DOGE program, but the VA still has yet to share, by the way, despite bipartisan requests, a full list of the thousands of contracts that have been cut by Secretary Collins in connection with the DOGE Elon Musk program. The VA has yet to respond to my May 19th letter demanding a full accounting of these haphazard cuts. And despite promises from multiple VA leaders to brief this committee on the cuts, we have yet to receive a briefing. Within the VBA and the VHA, do you have a full list of all the contracts canceled as a consequence of DOGE or because of the slashing cuts made by the VA secretary?
Senator, thank you for the question. I rejoined VBA in May of this year, so I wasn't there for the DOGE activities. However, I can tell you that we have the contracts that we need to support our mission.
Well, do you have a list of all the contracts that have been canceled?
I don't personally have that list, no.
Does anyone?
I'd have to get back to you on that, sir.
Do you know, Dr. O'Toole?
I don't, and again, we'd have to get back to you on that.
I can't speak for the committee, but I can for myself. I have no clue as to what excuse there could be for failing to provide us with that list after so many months, so many communications in hearings, and the letter that I did. So if you could take that message back, I would appreciate it. Dr. O'Toole, the last time you were here was in May. My office sent a request to the VA immediately preceding that hearing for data that we used to receive from the department. Some of it was publicly available regarding VA and community care wait times, VA wait times and community care wait times. 200 days later, since I made that request, I have not received any of the information that I asked for. As the Deputy Assistant Undersecretary for Health for Clinical Services, you oversee VHA field operations. When was the last time you received updates on wait times at the VA or for community care?
Well, sir, we track IC data related to VA wait times on a frequent basis, and we do track that. I would have to defer to my colleagues in the IVC office in terms of what the community wait times are.
Can you give us an update?
Off the top of my head, no, but I'm happy to,
Can you give us an update before we leave for the holiday break?
I will definitely try to, sir, yes.
Thank you. My time has expired. That completes my question. Thank you.
Thank you, Senator Blumenthal. Senator Tillis.
Thank you, Mr. Chair. Dr. O'Toole, the Senator Blumenthal asked you about the 250,000 or so people who may be on ACA subsidized care. Do we know whether or not, can you try and identify, frankly, if they're VA eligible, I would prefer for them to be getting care from the VA. So this may represent, I understand the fiscal impact, but this may represent an opportunity to find a swath of people who are going out to the exchange buying health care coverage when we can give them the extraordinary coverage that they could get within the VA. Now, the concern I have with that, is it kind of like calling roll by asking people who are absent to raise their hand? How would we find those people, and what was the basis for the analytics? I mean, it's one thing to estimate, but how could we get to a level of granularity where we know who they are and we can reach out to them and say there is an alternative, whether or not the subsidies get extended?
Yeah, it's a great question, sir, and, having been practicing in the VA for 20 years, I'm always an advocate of the care that we provide in that system. I don't know, and we'd have to get back to you in terms of what type of outreach effort could be taking place.
Clearly, if we have an influx and covered veterans, then we're going to have to deal with funding. But if they're not getting the subsidy on the exchange, there may be a source of funding that we should talk about. So I think it would be helpful for us to get that, regardless of what occurs, because I'm always looking for veterans to get the best care that they can, and I believe that's through the VA when given the option if they're eligible for it. Ms. Devlin, you covered, I think, about 8 or 10 of the bills on the list that I have before me. Do you have a formal position that you've communicated to us on the other pending bills, the longer list?
Yes, sir, we submitted testimony for the record on all bills.
Okay, I haven't seen it. Are there any hard no's? Not only do you not agree with the intent, you think it's a bad idea?
We did have some opposition.
Like as in, no, we don't want this policy to be passed? And that's in the record?
Yes.
Thank you. Then the only other question I had specifically, actually, let me see if I can find the bill. Oh, yeah. 2807, restoring eligibility standards for placement in eligible cemeteries. What's your position on that?
Thank you for the question. Our NCA partners are not here to testify on that bill.
But was that submitted to the record?
It was, sir.
And
yes.
what was the position in the record?
If you can give me just one moment, I will look it up in the testimony. If you'd like to ask me another question while I look.
No,
I'm
that's the
happy to-
last one.
Oh, okay.
Sooner you get to that one, the sooner you get rid of me.
Trying to avoid the awkwardness of going through
That's
the.
okay.
2807.
Appreciate your preparation.
Absolutely, yes, sir. Thankfully, they're in numerical order.
Yeah, if staff have feedback, y'all can whisper in my ear too.
I wanted to give you the exact language just so that I don't go on the record with the wrong language.
Well, the only reason, out of this entire list, I think I'm only co-sponsor on the Purple Heart Veterans Education Act, but that one gets out to me. It stands out in that I think that we have to have pretty significant consultation with DOJ. It sounds like directionally you are supportive. I've had the staff provide me something, but we really need to get that right. There are clearly instances where I can think of a tragic event in North Carolina where it would be appropriate for this, I believe, my personal opinion, appropriate. The circumstances at face value would not justify maybe making an exception, but I do think we need to look at it, but we need to have a very tight set of standards and I think strong consultation with DOJ before I'd be willing to support it. Thank you, Mr. Chair.
Thank you, Senator Tillis. Senator Murray.
Thank you, Mr. Chairman. You know, President Trump came into office saying that he would make IVF free. Instead, not only has the president not done a thing to lower the cost of IVF, he stood by now as Speaker Johnson cut a very straightforward provision to make IVF more affordable for service members as part of this year's NDAA. And on that note, I'm really disappointed to see that my Veteran Families Health Services Act was left off of the agenda today. That bill would give more service members and veterans the opportunity to grow their families, including through IVF, by expanding the fertility services that are covered under VA and DoD health care. it just seems like Republicans in this administration really talk a big game about IVF, but when it comes to actual policy, it's pretty clear who's in the driver's seat, anti-abortion extremists like Speaker Johnson. So I think just want to make it clear, I think it's pretty outrageous that Republicans won't lift a finger to help our service members, or anyone for that matter, to access IVF, and I think it is really important everybody here understands that. Dr. O'Toole, are you aware that service members face a higher rate of infertility compared to the rest of the population?
I'm not directly familiar with it, ma'am, but I take your word on it.
Well, it is true, and our service members, as we all know, they lay their lives on the line for our country, and I really believe, and I think many people do, that the least we can do is help them start their families when they come home. So again, I'm registering my deep disappointment and hope that that can change. Let me move on. As the daughter of a Purple Heart veteran, I know how much they sacrifice for our country. I take seriously our responsibility to be there for them when they need it the most. And unfortunately, right now, not all Purple Heart veterans are treated equally when it comes to their benefits. For example, post 9/11 veterans can transfer their GI benefits to their descendants while they're still in service. However, one of my constituents reached out to tell me about a problem he was facing because he received his Purple Heart after his service and was unable to transfer his GI Bill benefits to his daughter when she was looking to go to college. So the bill that I'm offering, which I'm glad to see on the agenda today, would fix that loophole. Ms. Devlin, you mentioned you wanted to see some changes, but let me just ask you, are you supportive of this legislation?
We do support the intent of this, and it's really technical amendments to ensure Department of War is involved in the process as they make they're responsible for the process of transferring eligibility.
Well, I'm happy to talk with you about what your recommendations are, but I think this is a really important piece of legislation. I hope we can move on it. And let me ask about the Molly R. Loomis Research for Descendants of Toxic Exposed Veterans Act. This is a bill that's really near and dear to me. Molly is a Washington State resident. She was born with spina bifida and it's believed to be caused by her father's exposure to Agent Orange when he served in Vietnam. And despite research showing descendants of toxic exposed veterans experience lifelong medical issues, there has yet to be a comprehensive government-led study of this issue. So my bill simply takes a very critical step forward by requiring research on health conditions that are prevalent in the descendants of veterans who were exposed to toxic substances during their service. Ms. Devlin, talk a little bit first about how this research would prepare VA to help future generations of veterans who've been affected by toxic exposure.
Thank you for the question. We take research objectives very seriously, and of course, for individuals with spina bifida whose parents were exposed to toxic substances, there is the Chapter 18 program which supports them, and that program continues today to support those dependents. There has been no significant association that we've seen through the National Academy of Science research to indicate that there is generational impacts based on toxic exposures. But we do have the infrastructure in place, and in fact, with the PACT Act, we have the infrastructure in place to determine that which research objectives to take on with the working groups that exist already.
Well, it's my understanding that there is research showing that descendants of toxic exposed veterans do experience lifelong medical issues. I think it is really important for us to look at this to make sure they are getting the support they need. So I thank you for your inclusion of this bill on the agenda today.
Senator Murray, thank you. I have taken an interest a long time ago in regard to next generation affecting the next generation by service of their parents or their grandparents, and look forward to working with you on this and other pieces of legislation.
Thank you.
Senator Kramer.
Thank you, Mr. Chairman, and thank you both for being here today. I want to talk a little bit about and get some feedback on my legislation that I introduced with Senator Sheehy from Montana, an even larger and more rural state than North Dakota. It's called the Critical Access for Veterans Care Act. I believe you're familiar with it. I mean, the VA did testify to it, I know. I'm going to just read a little bit of it. It reads a little bit like the girls I used to ask out in high school, and they'd say, well, we like you a lot and you have a good personality. Says VA strongly agrees with the intent to improve the quality. No conclusions. But you could guess. The VA strongly agrees with the intent to improve the quality and availability of care to veterans in highly rural areas like Montana and North Dakota. We support the goal of improving access for rural veterans and want to work with the committee to clarify how this new authority would integrate with existing VA care processes. In states as rural as North Dakota and Montana, we have very limited VA providers and facilities. In North Dakota, we have one hospital in Fargo, which is the very eastern edge of the state. We have, I think, 8 CBOCs. And the community care program literally can be a lifeline. And I say can be because the thing that prevents it from being a lifeline as often as it ought to be is of course, are all the roadblocks that get put up, all of the fine print, all of the exceptions, all of the, the slow walking and administrative hurdles for the veterans and the providers themselves to participate. So we've seen some administrations, prior administrations, intentionally put up some of these roadblocks and to deter veterans from using this option, even though it's the law and an option that we've all told veterans many times it's available to them. After hearing from veterans and rural health care providers and leaders across North Dakota, I proposed the solution, as I said, with Senator Sheehy. And it was to simplify access to the critical access network, whether it's critical access hospitals, rural health clinics, and the model. And as a point of emphasis, you guys, critical access is a designation specific to healthcare providers where they're the only hospital or the only provider in an entire region, many miles between the providers. Our system, our VA system, effectively discriminates against our veterans compared to their neighbors, their non-veteran neighbors and friends and family, by giving them less access to care that's readily available than they have currently. And so I mean, we just have so much opportunity here. I'm willing to work, obviously, I'm always willing to work to improve the details of legislation. We want to get it right. But parts of the testimony seem to indicate that the VA wants to maintain the control. And that's always the deal. All of the good language in the world, however, as long as we agree, that's not really a culture change. That's maintaining of control. So the goal is to give rural veterans access to local critical access hospitals without the strings attached. I mean, when we talk about wait lines, in the waiting room that Senator Blumenthal talked about, that is one thing. But the wait lines we're talking about are days and weeks and months to get permission to get the care that they need across the street rather than across the state. So I understand and again, want to make the language clear. You probably hear it quite a bit, I know I do, that prior authorization process for veterans is a nightmare. I mean, it not only takes a long time and oftentimes gets the wrong result, but it's just awful to do. So anyway, I worry that if the bill's watered down, quite honestly, that we turn this authority back over to the bureaucracy to decide. I want to say I've got a lot of support, Mr. Chairman, and I have several letters here, including from the American Hospital Association supporting the legislation as it is, other leaders, rural healthcare leaders from across North Dakota, and I would like to submit them all for the record if it's okay.
Without objection, so ordered.
All right. Anyway, with whatever time's remaining, which is now 25 seconds, Dr. O'Toole, maybe you could just elaborate a little bit on my rant.
Sure. Thank you, Senator. And let me say, first, we strongly support definitely the intent and the need for this legislation as it relates to rural veterans. I think the sticking point, which you noted, is really how do we create some clarity in language and direction as it relates to prior authorization versus clinical necessity. That can be achievable, and we're very much looking forward to working with you on how we get appropriate language to make that work.
Well, thanks, Mr. Chairman and Ranking Member Blumenthal for the hearing. To both Ms. Devlin and Dr. O'Toole, thank you for your service to our nation's veterans. Mr. Ms. Devlin, this may actually be a question that Dr. O'Toole is better positioned to answer, but as you both know, in May, President Trump signed an executive order that required the Secretary of the VA to direct a feasibility study and create an action plan regarding bringing a full-service VA hospital to New Hampshire. This action plan was due to the President last month. A few weeks ago, my New Hampshire colleagues and I wrote a letter to the Secretary asking him to make that action plan publicly available so that Granite Staters can have input. They can see it, have input, provide feedback. So can you, whichever one of you is in a better position to respond, can you please tell me when this action plan will be made available for my constituents to review and comment on?
Senator, I'll take that one on. I don't have the specific information. I will say that this is a priority of the Secretary. It is something that I know a lot of people are working on, and we will take it for the record to get that information for you.
I would appreciate that. We liked having the Secretary come in person to Manchester a little bit ago. It was a really good visit, but we really need to see the action on this, and we've been asking for a while. Ms. Devlin, I want to change gears a bit now and discuss how scammers are targeting veterans. Scammers, I bet everybody here has gotten a text, email, phone call, and been the target of a scam. According to the Federal Trade Commission, veterans and military retirees reported nearly $420 million lost to fraud just last year. And when you include active military members, reservists, and their families, that number climbs to more than $580 million. According to the FTC, the top type of fraud affecting our military and veterans was imposter scams. Those types of scams alone add up to almost $200 million. Ms. Devlin, can you please discuss how scams and financial losses can affect veterans and their families and what the VA is doing about it?
Thank you for the question. We take this very seriously, and we have multiple efforts underway to prevent fraud from even happening, from even affecting a veteran. But it does affect veterans. And so what I'd like to share with you is that we have, in the last couple of years, prevented $9.6 million from being stolen from veterans' accounts. The bad guys are always changing their approaches, and we're always evolving to make sure we're one step ahead of them as much as we can. So a lot of what happens is really the redirects, the attempt to redirect finances from a veteran's account to another account, and that's the $9.6 million that we prevented from happening. And when it does happen, we provide one-on-one remediation support. So if a veteran or a service member or family member is subject to or victim of fraud, we'll provide remediation support one-on-one through our fraud team. And we do extensive outreach and communications, even with the latest fraud scheme where veterans are getting a message saying they have a VA overpayment, and it's not true.
Right.
And we've sent out communications and reached millions of veterans with that information.
Well, I appreciate that very much. And you mentioned your fraud prevention or your fraud remediation teams. One of the things I'd like to continue to do is work with you to address this issue and find ways to strengthen our support and prevent even more losses. One way we can do that is to make sure that the VA's efforts on scam prevention and education are fully supported. Senator Cornyn and I introduced the bipartisan V-SAFE Act, which would require that the VA have a scam and fraud evasion officer, ensuring that such a position is congressionally codified and congressionally supported so that there's a specific person in office to lead the VA scam prevention efforts across administrations. And so I'd love to work with you on that legislation, and also interested on what additional ways you think that Congress and the VA can work together to address scams and fraud.
Happy to work with you on that, absolutely.
Yeah. Just for my colleagues' knowledge, if they don't know, that the overall cost of these scams now economy-wide around the world is over $1 trillion in losses a year. It is now outpacing the illicit drug trade. So it's just something we all got to really take on together. Thanks so much.
Senator Hessen, thank you. Senator Bozeman is recognized.
Thank you for being here, and we appreciate you and Senator Blumenthal for calling the meeting. And this is really good stuff that we're discussing. I want to start with discussing the Veteran Burial Timeliness and Death Certificate Accountability Act. Families of veterans have suffered delays in certifying their loved ones passing as long as 8 weeks. This creates difficulties for the families to receive death benefits, receive with burial honors, and forces local government to maintain possession of the veteran's body. Mr. O'Toole, does VA policy allow a physician assistant to certify a death certificate in states that require a physician or coroner to certify?
Thank you, Senator. And specifically related to this bill, I want to note that the VA supports it, absolutely, although there are some amendments that we would recommend. The first is that physician assistants who are practicing as independent providers in primary care, specifically, we feel should be included in those clinicians able to sign a death certificate, which is standard practice in many states already. Our other request is that we go for, instead of 48 hours to 2 business days, which is our current practice, and also reflects the challenges with 95% of the deaths occurring outside of a VA facility, some of the logistic requirements dealing with holidays, weekends, and so forth.
Mm-hmm. Very good. Can you explain the processes a VA physician must go through to sign a death certificate and compare that process for when a veteran passes away outside of a VA facility?
I can tell you from my own experience, usually it's a notification by the medical examiner or a mortician's office about a death, and requesting the certification be completed in a certain time. Obviously, it is greatly facilitated if that patient has been seen recently, and the records are appreciated on a natural, for natural causes. Again, it's a little bit trickier if the patient has not been seen recently or the death occurred in a circumstance that might not be consistent. And that's pretty usual, whether it's within the VA or outside the VA system. We recently stood up an office and put out a directive as well as training for all of our VA clinicians that's intended to clarify and codify those processes internally for us.
Very good. Ms. Devlin, can you speak to the importance of death benefits for the families of veterans and the consequences of delaying their delivery?
Absolutely. We work with many sources of information for first notice of death because we want to make sure that the survivors receive their benefits in the most timely manner. We've reduced our inventory of dependency and indemnity compensation claims dramatically, working on getting those timely benefits to survivors.
Very good. I'm proud to be an original co-sponsor of the VA SAFE Act of 2025. Veterans are uniquely targeted by scammers to exploit their access to benefits. Ms. Devlin, can you talk about the legal difficulties in recovery from a scam?
I'm not an expert in legal recovery from scams, but I can tell you we take very seriously protecting our veterans from fraudsters. We have many efforts underway, and as I mentioned earlier, the bad guys are always changing their techniques, which means we have to be sharp and continually evolving our practices. We saved veterans from multiple fraud attempts based on our efforts. And I can tell you that identity theft and other types of fraud can be very catastrophic for families. Financial loss, loss of credit, all sorts of problems can result. And that's why we provide one-on-one remediation to our veterans and their families if that does happen to them.
What does the VA lack in ability the scam and fraud officer could provide?
I'm sorry, can you repeat the question?
What does the VA lack in ability that a scam and fraud officer could provide?
I think we have the capability now. Creating a fraud officer, we did support the bill. Having that position codified in law would strengthen our capabilities just for the mere fact of that position being a permanent position. And that individual would work with all of the administrations because we have unique situations in VBA and VHA and NCA that are uniquely different in terms of how fraud can affect our veterans that we serve.
Very good. We appreciate it. These are little, they're not little things. They're things that really do affect people a great deal. And both with inconvenience and, as you pointed out, Ms. Devlin, just the adverse things that can happen as a result of the scams. And then two, not being able to get a death certificate in a timely fashion. And we can argue about what timely is, but in some cases it's not timely. We do need to correct that because it really does put people in a difficult situation. So thank you, Mr. Chairman.
Senator Bozeman, thank you. Senator King.
Thank you, Mr. Chairman. I wanted to talk a bit about S 926, a bill that Senator Sheehy and I have introduced. Senator Gallego and Collins have also joined in support. It involves falls prevention. I'm sorry, that's next. It involves a lockbox for firearms. I don't have to talk to you about the grave history of suicides among our veterans, 75% of which involve firearms. I did a calculation. About one veteran every 2 hours takes their own life with a firearm. And what we're proposing here is based on a successful program in Utah, where it's basically a free lockbox for veterans that apply. There's no Second Amendment issues, purely voluntary. And the research, as I'm sure you know, Doctor, if you can lengthen the time between ideation and action, you're going to save lives. I know that the department has a kind of pilot program, and they're worried about the cost, but I hate to think that cost is going to be the barrier to saving a life. I mean, what's the value of one veteran's life saved? So I hope you'll take a closer look at this bill. I don't think it's we estimate $5 million a year. That would be 33,000 lock boxes. And that's a pretty good uptake rate. So, Doctor, your thoughts, and I hope I can move you a bit on this.
Well, thank you, Senator. And first, thank you for introducing this bill. And I know we've talked about it previously, and this is obviously a priority for the Secretary. It's a priority for the VA. Any suicide is one too many. And you're absolutely right. Anything that creates some space between that impulse and that action, whether it's in securing medications or securing firearms, critically important, and it'll save lives. We need to work with you on this. I think our concerns about the recommended appropriated amount of $5 million is something that I'm hoping we can work through to be able to hopefully create some comfort in terms of what is the right amount. Our efforts to date have been focused on providing lockboxes to those veterans identified as having moderate or severe risk, and clearly coupling that with the wraparound services and mental health services and social support services that
But as you know,
hopefully
that's
will
had
help.
very limited uptake.
Absolutely. We need to do more. And I was going to add also, we have the gun cables that are more generally available. But, the technology and the capacities with lock boxes is preferable to the cables.
Let's continue our discussion.
Yes.
Because I think this is, like I say, every 2 hours, a veteran dies by firearm suicide, and we ought to be doing whatever we can. And, Mr. Chairman, I'd like to submit for the record, I think it's 20 communications from 24 different groups supporting this bill, so I'll submit that for the record. The second issue I want to talk about briefly is falls. 1 out of every 4 people over 65 have a debilitating fall. The cost of one fractured hip is between $40,000 and $50,000. Falls prevention, to me, is the low-hanging fruit of lowering the cost of health care. It's an epidemic in this country. And Senator Rounds and I and Senator Blumenthal, as you know, have a bill that basically puts a focus on this issue within the department by creating an Office of Falls Prevention. And my philosophy of management is you need somebody in charge who's responsible for a particular program, otherwise it just falls away. The way I used to put it in business was one throat to choke. And what I'm talking about is somebody who's responsible every day when they get up saying, how can we prevent falls among veterans? So again, I think you've been somewhat negative about this bill, but seriously, this is something, as I say, it's the low-hanging fruit of prevention, not only of financial cost, but of the terrible toll that it takes on our veterans and their families.
No, and you're absolutely right. I mean, falls are a preventable cause of significant morbidity and mortality. And we obviously, with our aging veteran population, need to have that focus. Our concern or basis for objection is that much of the work is underway. We launched a falls office within the National Office of Patient Safety this past year. And we are doing a lot of the things that the legislation calls for. And, our concern is that creating, or enacting the legislation, we don't want that to be taken from the momentum of what we are currently doing. But, again, let me please, extend the offer for us to be able to work with your office to be able to find some common ground to be able to move this
I'd
forward.
appreciate that. And it may be just some modifications to what you're already doing and sort of beefing it up, because again, this is a real opportunity to relieve a lot of pain and suffering for our veterans, but also pain and suffering for the taxpayers. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Slotkin.
Thank you, Chairman. Thanks for having this hearing, and you're coming to the end because I'm at the end of the dais, so it's almost over. And I appreciate you really have had like the grab bag of issues, so it's not like a hearing on one issue. Thank you for taking all of our particular questions. I want to follow up on an issue I feel very strongly about, which is toxic exposure for our veterans. Particularly burn pits. I was a CIA officer, not a veteran, but lived in Iraq for many years of my life, and the burn pit exposure, I mean, you didn't have to be a doctor to understand that it's pretty crazy to live close to a place where you burn all kinds of trash. And we passed the PACT Act, which I think was a really important lesson, that we weren't going to let the 9/11 veterans have to fight for 30 years the way that the Agent Orange folks, exposure folks in Vietnam had to fight. And so, we got a bunch of new veterans into VA care who had, served in places where we burn our trash. And I was proud to play a really small part of that. But the bill that I'm interested in now is kind of like the next part of that story, which is the Molly Loomis Research for Descendants of Toxic Exposed Veterans Act. Is basically this question that I think is unknown right now, is if you are exposed, you have toxic exposure, burn pits, and you've served for a long time, what, if anything, do you pass on to your kids? And I think there's like a lot of open questions here about that. And so the bill is just basically, can we research that? Can we get some data behind that? But I understand the VA is against it. Can you walk me through your sort of feeling on the bill, but then just what's the next step the VA is looking at for toxic exposure, particularly for the 9/11 era veteran?
Yes, thank you so much for that question. We believe that we have the infrastructure in place. Part of it was put in place by the PACT Act to research conditions, exposures that we believe have science behind them, and we do some preliminary research, and then we determine which ones we need to delve into and do the more extensive research. We work with the National Academy of Science and Medicine and Engineering on these. There's not been a significant association shown at this point that shows any descendants impact of toxic exposures. We are researching some other exposures, and I'm happy to share those with you, but they're not related to descendants.
You have some sort of program that's been funded by the VA or sponsored by the VA that looks at the descendant piece, not other, because certainly we had a long debate in the PACT Act about which conditions would qualify. Do we actually have science to link to the toxic exposure, which I get, but is there actually a funded project looking at the descendant piece, the children?
It's not specifically looking at descendants. We determine, as I mentioned, which exposures, which locations, particles, specific items that veterans are exposed to during service, and determine which ones require further research. As I indicated, the last research on toxic exposures for descendants, which was in 2018, did not show a significant association.
Okay, well, maybe I just like to see it because we hear this, and again, I understand we need the science behind it, but we certainly hear from veterans, that era of folks have now, many of them have had children, and they feel like there's similarities across what they're seeing in their own children. So I just think it's important that we understand and have done the work. But I'll look at the 2018 stuff, but I certainly think the demand signal is there.
Happy to share it with you.
Thank you. And then the other issue I just wanted to talk about was on this kind of communication when veterans leave the VA system and go out on the open market for their care, right? And it's something that has been much discussed here. We keep hearing that there's problems when someone goes out into community care in like their records coming back to the VA, that there's this drop off. And so again, there is a bipartisan bill, the Caring for Our Veterans Health Act, which would just improve information sharing between the VA and these, normal providers out on the market. Can I get your thoughts on that? Because we want them to get the care, but then it shouldn't be up to the veteran to have to slog and get the records back to the VA.
No, absolutely, and I appreciate you bringing it up. It's a concern and a challenge for us. The OIG has investigated, looked at it, identified issues and problems as well. Much of the efforts involved are going to be captured in the next gen contract with a role for an enhanced role for the TPAs, the third-party administrators, in terms of collecting and managing those records. And our position on this bill is that we are better served working through a contractual and business arrangement rather than having to legislate for the outcomes that we're trying to achieve. But absolutely, we share your same concerns with this, and it's more of a strategy issue.
Great. Happy to keep talking about it. Thank you, Chairman. Yield back.
Slotkin, thank you. I was just expressing to Senator Blumenthal that I think he and I, to my knowledge, were the first to introduce legislation, and it became law. It was the Toxic Exposure Research Act of 2015 that looked at the consequences to the next generation of toxically exposed veterans. My awareness of this issue came from the Vietnam Veterans of America Forum conference they had in Wichita, Kansas, that I attended, and it's why I indicated to Senator Murray I'm interested in continuing. She asked similar questions to yours, interested in working with you and others to see that the answer. I was going to ask Ms. Devlin what I think I heard her say, and I think that research was done according to that Toxic Exposure Act of 2015, and what the conclusion of that research was what?
So the conclusion of that research from 2018 was that there was no significant association between toxic exposures in the Asia areas were related to children, descendants of those veterans.
What did that research consist of? How was that research conducted?
It was conducted in collaboration with the National Academy of Science and Medicine. So we can provide the report to you.
I've seen it, but it's been a while.
Sorry. It has been a while.
And then, did you also indicate that there, perhaps as a result of that conclusion, or the research conclusion, that there is no research currently ongoing at the VA related to this topic with the next generation or their veteran parent or grandparent?
Not to my awareness, unless Dr. O'Toole is familiar. No, not to my awareness. Not on descendants specifically.
Senator Slotkin, again, I have an interest in this topic. And Senator Blumenthal.
Just to clarify, are you aware of other research outside the VA that's ongoing with respect to this issue?
I'm not aware of any research on descendants. Are you, Dr. O'Toole?
Yeah, I'm not aware, but I will also say I haven't been actively tracking. We do track it actively, as part of the PACT Act of current veterans, but as far as descendants go, I don't know. And, 2018 was a while back.
Well, and 10 years ago, what I recall from the conference I attended, it was very vivid. It sticks with me 10 years later about the significant circumstances I heard about and saw related to veterans and their next generation. Senator Slotkin?
Yeah, I just will say briefly, and while, again, we certainly have heard from Vietnam veterans their perception that things can be passed on to their kids, but would just offer, and I'm not a scientist, but Agent Orange exposure can't be exactly the same as burn pit exposure. And I just think, at a minimum, if you have a bipartisan interest in supporting that kind of research, I think it's sort of part of what we owe to folks. If there's a possibility that it affects their children, I'd be happy to see this committee push it forward. So
I think that, if I may, Mr. Chairman, I think
Senator
that Senator Slatkin is absolutely right that this area really cries out for some bipartisan action, and I'm struck by the stories that I have heard from veterans about children bearing the diseases and afflictions that are attributed by medical experts to the exposure to the burn pits and other kinds of toxic substances, including in this country at Camp Lejeune, parents having children who may be affected by the contamination of that water there. So thank you, Mr. Chairman, and thank you, Senator Slatkin.
Good. Thank you, Ms. Devlin, and you, Dr. O'Toole, for joining us today. And we dismiss you. That sounds like a harsh word. We'll now ask the next panel to approach the desk and join us. Thank you. All three of you for being here, and with that, Mr. Brown, I'll recognize you first.
All right. Well, thank you, Mr. Chairman, and Ranking Member Blumenthal and members of the committee. Paralyzed Veterans of America would like to thank you for the opportunity to testify on some of the pending legislation impacting VA that the committee is reviewing today. Obviously, there are many bills on the docket, so I'm going to limit my comments to just three of them that we feel most closely impact our members. First, PVA supports the Review Every Veterans Claim Act, which seeks to limit VA's authority to deny a veteran's claim solely on the veteran's failure to appear for medical examination that's associated with the claim. Thousands of veterans' claims for service connection, claims for increase, and for other benefits like total disability, individual unemployability, and aid in attendance have been denied solely because of missing an examination. There are many legitimate reasons why a veteran may not be able to attend a scheduled exam. We are also aware of numerous instances where VA contractors erroneously record the veteran as a no-show. Veterans with SEIDs often encounter multiple barriers in travel when compared to other veterans and are apt to miss some of these appointments. We believe that passage of this legislation will ensure that a missed exam isn't the only basis for denying the veteran's claim. VA should also carefully consider whether an examination is needed, since many veterans with SEID already receive most of their care through the department's SEID system of care. Therefore, their records have adequate information to provide an accurate picture of their disabilities. We also support the Veterans Appeals Efficiency Act, which would establish additional reporting and tracking requirements for the Veterans Benefits Administration and the Board of Veterans Appeals, such as information on higher level reviews, supplemental claims, and notices of disagreement. It also requires the tracking of claims pending in the national work queue, not assigned to an adjudicator, cases that are remanded by the board, Veterans Appeals Improvement and Modernization Act cases pending a hearing, and when a decision maker did not comply with the board's decision. We recognize the value of and support efforts to track meaningful data to improve the effectiveness and accuracy of the claims process. However, the data sought by this legislation will be meaningless unless the department addresses the problems that hinder their ability to obtain proper medical opinions, since this continues to result in remandable errors. This act would also give the board the authority to aggregate certain claims. And while PVA does not oppose allowing the board to aggregate appeals involving common questions of law or fact, we believe that before that can be done, a feasibility study should be conducted and the findings reviewed. Then legislation based on those findings should be brought forth. And then finally, in times of fiscal constraint, joint use agreements between DoD and VA should be highly prized for their ability to increase access to care for service members and veterans while reducing overall federal spending. Such agreements allow for the sharing of medical personnel, facilities, and resources, which can lead to faster access to high-quality care and improved medical outcomes. They also reduce bureaucracy and improve the efficiency of the system. DoD and VA have had the authority to execute these types of agreements for decades, but have never really used them to achieve their full potential. PVA supports the SERVE Act, which reinforces some of these existing authorities and will improve access to health care by improving collaboration and increasing the use of these agreements between the two departments. I thank you again for the opportunity to share our views on some of the bills, and I'll be happy to answer any questions you may have.
Mr. Brown, thank you so much. Ms. Springer, your testimony, please.
Good afternoon, Chairman Moran, Ranking Member Blumenthal, and members of the committee. On behalf of the men and women of the veterans of foreign wars of the United States and its auxiliary, thank you for the opportunity to provide our remarks on the legislation pending before this committee. My written testimony includes the VFW's positions on all the bills under consideration. This afternoon, I will highlight three. First, the VFW supports S1657, Review Every Veterans Claim Act of 2025, legislation we have championed for the last few years. This bill would amend Title 38 to ensure that VA may not deny a disability claim solely because a veteran missed a compensation and pension or CMP examination. We believe this bill would move VA towards a more flexible and veteran-centered claims process, as scheduling conflicts do arise and veterans should not be penalized when unavailable. We understand that veterans miss CMP appointments for many reasons, such as illness, lack of transportation, work conflicts, or just simple misunderstandings. They should not be forced to restart their entire claim because of a single missed appointment. The VFW has assisted many veterans who had to reopen claims for this reason alone. Restarting a claim from the beginning is unnecessarily burdensome and can be mentally exhausting. Instead, we recommend that VA return the claim to the work queue with a missed medical examination flag so the process can resume exactly where it stopped. We also recommend that when the evidence already in the file clearly establishes both the existence and severity of the disability and would lead to a favorable outcome, VA should adjudicate the claim based on that evidence alone. Conversely, when the record is insufficient, a CMP examination should remain mandatory to ensure a fully informed decision. Next, the VFW supports S1992, Veterans Appeals Efficiency Act of 2025, which would give the Board of Veterans Appeals, or BVA, and the Court of Appeals for Veterans Claims additional tools to improve the efficiency of the appeals process, reduce the backlog of appeals at BVA, and allow appellants to receive quicker decisions. Specifically, it would allow BVA to aggregate similar claims and decide multiple appeals simultaneously. It would grant BVA precedential authority, if feasible, that would reduce repetitive litigation and promote greater decisional uniformity, and would clarify evidentiary support for an advancement on the docket request and the typical timeline for a decision. For the Court of Appeals for Veterans Claims, the bill would expand the court's ability to certify class actions, helping resolve systemic issues that affect many veterans similarly at once. It would codify the court's authority to issue limited remands, which would allow BVA to correct a specific error without reopening an entire multi-issue appeal. Although limited remands would enhance efficiency, they're rarely used because no clear criteria currently exist. This legislation would change that. Today, many veterans wait up to 2 years for a BVA decision, longer if they request a hearing. With a number of pending and projected appeals, BVA cannot likely make meaningful progress using its current processes. These tools will provide an opportunity to break that paradigm and streamline the appeals process. Finally, we support the bill's enhanced reporting and data tracking requirements. However, we recommend two additions to increase accuracy. First, track the impact of natural disasters on docket advancement, as they can significantly delay case movement, and track cases in which an eligible survivor requests substitution for a deceased claimant for the purpose of pursuing the claim to completion. Lastly, the VFW supports the discussion draft titled Sharing Essential Resources for Veterans Everywhere, or SERVE Act. This proposal would strengthen collaboration and resource sharing between VA and the Department of Defense, or DoD, to expand healthcare access for veterans, especially those who live near military medical treatment facilities. Allowing veterans, particularly those in rural or underserved areas, to utilize nearby military hospitals and clinics would reduce travel burdens, shorten wait times, make better use of federal medical capacity that might otherwise go unused. Increased resource sharing would also promote better systems integration between DoD and VA, support cross-credentialing of staff, and facilitate joint training, all of which would contribute to better continuity of care for both active duty service members and veterans. While successful implementation would require attention to funding, staffing, and data integration, this proposal would represent a significant opportunity to better leverage existing federal health care resources for veterans. Chairman Moran, Ranking Member Blumenthal, thank you again for the opportunity to share the VFW's remarks. I look forward to answering your questions.
Thank you very much. Mr. Stitchman.
I'd like to thank Chairman Moran, Ranking Member Blumenthal, and the members of this committee for the opportunity for NVLSP to present our views regarding the pending legislation before the committee. NVLSP firmly supports, as do my colleagues on this panel, the Veterans Appeals Efficiency Act, S. 1992, which contains several reforms that would meaningfully improve speed, accuracy, and efficiency in the adjudication of benefit claims at the VA and at the Veterans Court. First, the Veterans Appeals Efficiency Act would restore the supplemental jurisdiction the Veterans Court used to have in cases in which a veteran denied benefits by the BVA seeks certification of his appeal to the Veterans Court as a class action. S. 1992 would overrule the recent decision of the Federal Circuit in Score v. McDonough. The rule announced in Score bars the large majority of similarly situated veterans with pending claims at the BVA or RO from being included in the class and counting towards the numerosity requirement of there being at least 40 putative class members. S. 1992 would require the Veterans Court to use the same approach used by all other Article III courts who handle class actions, namely, counting towards the numerosity requirement similarly situated veterans with appeals pending before the BVA or on supplemental claims before the regional offices. This would ensure the continued viability of class actions, which for years have helped streamline the VA benefit system. Second, Section 2E of S. 1992 would encourage the court to exercise its existing authority to issue limited remands. Currently, when the Veterans Court encounters a defect that requires agency action on one issue in an appeal involving multiple issues, the court typically remands the entire case back to the BVA for correction of one error without addressing any of the other issues. This piecemeal approach adds years to the adjudication process and results in substantial delays for veterans. Although the court possesses the ability to issue limited remands while retaining jurisdiction over the rest of the case, it rarely does so because its authority is not well defined and current precedent confines its use to exceptional circumstances. The Veterans Appeals Efficiency Act codifies the court's existing authority to order limited remands and instructs the Veterans Court to develop guidelines governing their use, including authority to require the BVA to act within a specified time frame so that the case may expeditiously return to the court for a final court decision that disposes of the entire appeal. By directing the court to articulate standards for when and how limited remands may be used, this bill will enable all participants in the system to understand when limited remands are available and the proper process for requesting them. This reform turns an underused mechanism into a practical, accessible means of reducing delay and expediting relief. In addition, NVLSP supports Section 2D1 of the Veterans Appeals Efficiency Act, which aims to reduce the backlog of veterans benefits appeals by confirming the BVA's authority to aggregate appeals. While more than 70 other federal agencies have rules that facilitate aggregation of administrative appeals, the BVA is an outlier in insisting it lacks power ever to group together appeals raising the same question of law or fact for efficient adjudication. The bill would codify the authority of the BVA to aggregate claims in appropriate cases after a federally funded research and development center does an assessment with VSO input of the feasibility of BVA aggravation and precedential decision-making. I'd be happy to answer any questions you may have. Thank you.
Thank you. Took me back to my practice of law or law school. I'm not sure which, but something sounded familiar in your testimony. Senator Blumenthal?
I just want to apologize. I have another commitment that I have to go to, but I actually think this testimony has been very important, and I have really no substantive questions. If I think of any, I will pose them in writing to you, but I want to thank every one of you for your service, and we hopefully will move forward. Thank you. And I thank the chairman for his courtesy. I also want to put in the record, if I may, Mr. Chairman, an analysis from the Urban Institute. I believe I referred to it earlier, that provides the basis for the number 267,000 veterans that I mentioned earlier as the number who would lose their insurance if the subsidies are not extended.
There's no objection to be entered.
Thank you.
Senator King, is it helpful if you go before I do? Well, now that I've offered, you could accept. Senator King bill, along with Senator Banks, 1657, and I consider its passage a priority. It seems odd to me that it's necessary, and I was wondering if any of you have the statistics that demonstrate how often someone is denied their opportunity for a claim because of missing a physician's appointment. Is it a significant problem, or it's a rarity? I'll check with my caseworkers and I'll find out.
I was going
Mr.
Mr.
Brown.
Chairman, I don't think it's a data point that we actually track per se, but we are aware from time to time, talking with our service officers, that they're having to go back after the fact and attempt to get one of our members back into the system.
Well, certainly if the VA cannot, I mean, I'd encourage the VA to fix the problem itself immediately in the absence of that, or maybe even with that occurring. I look forward to the passage of this piece of legislation. I want to ask about the SERVE Act. Really, for each of you or any of you who have a thought that you'd like to share, from your vantage points, working directly with service members and veterans, where do you see the biggest gap in health services during transition from DOD to VA? And do you believe this legislation can be a part of the solutions to those problems and desire to improve the continuity of care? Mr. Brown, you seemed perhaps the most anxious.
So I was going to say, I was just thinking, what would be the greatest area for me? And if you don't mind, I'll share like my personal experience.
Please do.
Currently, I'm fortunate that my primary care manager for VA is a provider that I saw while I was serving on active duty. And I think that one of the bigger advantages in terms of transition, if we were to expand access for veterans to be seen in the DOD system, certainly being able to see a provider that already knows your history so you don't have to repeat it, would be a clear advantage.
You had heads nodding behind you, so you've hit upon a point that apparently needed to be made. And I assume that the availability of that opportunity is going to be geographic. It depends on where that provider is and where that veteran is.
That is quite true. I just happen to live outside of Andrews Air Force Base, and she works at the Seabach on Allentown Road, so
Great.
most fortunate.
Anyone else, Ms. Springer?
And Mr. Chairman, I would go along with Mr. Brown's comments, and I'll use a personal story as well. I don't use VA care, I'm a TRICARE beneficiary, but very similar in some cases. And I think transitioning from active duty to a veteran status, there's a lack of familiarity in the process. I use a military clinic on board of Fort Myer, which is very close to my house, and that is just like being on active duty. I go there, I have a primary care manager, they get me in for appointments. If they can't do it, they send me to another clinic in the military treatment facility realm, or they send me out in town, but it's very familiar, and I think that would help transitioning service members to keep up with their medical, get signed up, and go to a place that's familiar, which is a military treatment facility.
You know, part of my interest in this legislation revolves around Fort Riley and Irwin Army Hospital, and then the VA in Topeka in particular, but VA hospitals in Kansas. And as you described that, I was thinking, well, that'd be a rare thing for in Kansas because we live so far from, you know, Fort Riley and the Irwin Army Hospital, for example. But that's for a lot of veterans, for a lot of service members who retire near the last place they served or the place they served and want to retire to, there is a military hospital that would be of great benefit that you just described to me. So I appreciate both of those stories. Mr. Stitchman, anything you want to add?
No, I have nothing further to add to that.
Thank you. And one more question, and that's on the Fisher House. Just for my help, I think this is a piece of legislation that we will be able to pass, and it will become into law, but I'll be visiting or speaking about it with my colleagues, either in person or on the floor of the Senate. And based upon your members' experiences, how significant is the unmet demand for lodging today? And do you believe expanding eligibility will improve access to care? Why or why not? What role does housing play in access to care? And is it a challenge in many places? Ms. Springer, you seem the most interested in responding.
I'll take a stab at it, Mr. Chairman. This hasn't been brought to my attention as a huge problem, but anytime you go get care, you have to think about the logistics, and you have to think about where am I going to house my family members, how much is it going to cost, and how is that going to affect my willingness to go. And if there is unused space in these Fisher houses, which are wonderful institutions, if there's unused space, I think that's a very positive thing to do rather than have it sit empty. Have people fill it up, active duty members and families on a space available basis, I think is a very good thing, and we support this proposal.
Thank you. And I, again, would use the opportunity to thank Fisher House and what great work they do across the nation. Senator King.
I'd like to join you in the thanks to the Fisher Foundation for the work they do. It's amazing. On the issue of transition, we had a bill before our hearing, I think it'll be at our next markup, that would allow active duty service members to pre-enroll in the VA healthcare before they transition out, so there's no gap. Mr. Brown, do you have any views on that idea?
I believe we would support that legislation.
Good. That's what I was hoping you would say. Let the record show. Mr. Brown, you heard me in my exchange with the doctor about falls, and we have a bill in to deal with to try to focus the attention of the VA on falls. Give me your thoughts on that, please.
So PVA supports your legislation. I listened, I think you've mentioned it twice now. 1 out of 4 veterans over the age of 60, was it, or 65?
65.
Okay. So I don't meet the second criteria yet, but I did meet the first criteria, and I was thinking that, well, you got to count me twice because I've had 2 major falls that have resulted in a significant health issue. One that not only incapacitated me for several months, but it also required my wife to take off time to work to get me to my appointments and back and forth, extensive physical therapy and the like. So I personally understand the value of fall prevention. And we know that every major area, service area within VHA certainly has their individual fall prevention programs. It's extremely important for veterans with an SCI, MS, and ALS. But I do agree with you that I think that VA would benefit from having like that one single point of contact, and from the sounds of things, from Mr. O'Toole's testimony, it sounds like they're already headed in that direction. And I'm sure you'll look into that with them and verify that. But otherwise, we think that your legislation is appropriate.
Thank you. Any other comments on that, Ms. Brigger?
Yeah, Senator, we would actually propose that the existing structures that VA already has be strengthened. There are already offices that deal with falls prevention. Instead of, we're not really in favor of creating a separate office for that, but instead take those offices that are already doing this and strengthen them, codify what they're doing, and ensure that some kind of discussion about falls is at every medical appointment, not just an annual physical, but every time that veteran comes in for care, somebody's asking about falls, because I agree, it's a very significant problem, and it can lead to other more serious health problems.
But we'll look forward to working with Dr. O'Toole and the agency to focus how to strengthen, as you say, the current structure and give it a focus that will increase the effectiveness. Second issue I wanted to talk about was the bill that I mentioned with Senator Sheehy on safe gun storage. Ms. Springer, do you have any thoughts about that issue?
Yes, we support that bill. We are very aware of the problem with suicides in our veteran population, and we do think that that would help decrease those incidents. Anything we can do to separate a person who may be having an impulsive thought and lethal means is something that we would support. And I think that you can easily roll this out and get it up and running. We do support this bill.
Thank you. Thank you very much. Mr. Brown, did you have a comment?
BVA shares the same view.
Thank you. Thank you, Mr. Chairman. Thank you for this hearing.
Thank you, Senator King. Let me ask this panel, you heard the testimony of the VA, Ms. Devlin and Dr. O'Toole. Anything you heard that you want me to ask them in a written question? Is there something that they said or didn't say that you'd like me to further explore? Apparently, Dr. O'Toole and Ms. Devlin passed the test. Okay. I think we are going to conclude the hearing, and I want to again thank the second panel for their testimony as well as the first, and I thank our members of the audience and the members of our committee for being here today. Senators who would like to submit written questions for the record to today's witnesses or additional statements have a week to do so. I've asked our witnesses to respond to any questions for the record they receive following today's hearing in a timely manner. And we've had conversations this afternoon about how we want to have a markup on these bills and move forward. And I've asked the staff to try to schedule that as expeditiously as we can accomplish. So we intend to move forward and.
Senate time or real world time?
Well, I can tell you the Senate time has something to do with whether or not we will be expeditious.
Yes.
They are related.
I do have one piece of advice for you. If St. Peter ever comes to you and says you have 10 minutes to live, your response would be, could it be during a 10-minute Senate vote? Because you'll have about an hour.
Well said. With that, our hearing is adjourned.